The pandemic was a very good example for how we can be exposed to a disaster or an emergency situation rapidly emerging and involving everybody all over the world.
The Suez Canal is another very good example. Just one ship blocking the canal for a very short period of time disrupted our supply pipeline.
To me, it's not one event necessarily. I think it has been insufficient attention to supply chains.
I would like to say COVID, but that is not true. A lot of the challenges we had during COVID were in existence pre-COVID. And hence the reason why the world decided on the Sustainable Development Goal number 3, that goal will enable us to achieve health services for all by the year 2030. Why? Because again, the supply chain was not functioning at its optimum.
COVID did reveal to us how we were all going to the same places to look for what we required. And once those countries closed down, we saw how it affected the supply chain, how we were not able to get what we needed when we needed. And that also trickled down to the logistics part of it, how are goods going to get from where they are to where we need them.
Sometimes I worry that supply chains are so far removed from the patient, it's much easier to make investments that directly affect a patient. Supply chains are several steps removed, so they're not as sexy. They don't resonate with politicians, with investors as much because they're the backbone, but you don't see the impact immediately.
A major event would be when aid was introduced to Nigeria. We had less people dying from HIV/AIDS, and we were able to maintain a lot of people. To date, it's not an endemic situation again. However, what that triggered was our governments focusing on aid and ignoring the provision of resources for essential medicines for the country. You have to have a balance. Now it's picking up, but it's going to be a journey, because we not only look at the commodities, we look at the infrastructure, we look at the people to do that work. So yes, introduction of aid, good, but
Can't think of a time when we've actually met our goals. In terms of a patient goes into the hospital, they get the services they need, they walk away and they're happy. Now, we missed the goal, patient outcome. That is the measurement of our health system. What is the outcome for the patient at the end of the day when that patient comes to the hospital? The key things that sort of have contributed or attributed to this is one, governance, whether we like it or not. You know, we have policies, we have lots of policies, we have lots of documents that have been written, but the implementation is a problem. And that is not for the government alone to do. And that is why we need to have the private sector on board, we need to have the churches on board, we need to have all the other entities that are out there. They're a part of that entire system.